my name is Cedeno, and I'll be demonstrating how to do trach care. So a couple indications would be if it's visibly soiled or just routinely, so do it at least once a shift. And some contraindications that you would just want to make sure that you're not doing it within the first 24 hours of the patient getting their artificial airway. Some complications or hazards would be bleeding, coughing. They can grow granulomas around the site, and it's decannulation. So you would go, before you go into the patient's room, you would just go over the patient's chart, see any significant findings. You would see if the patient has a metal trach. In that case, you would always just want to get an adapter to the ambu bag, just in case you would have to bag the patient. And so then you want to gather your equipment. So you want to get your trach care kit. You want to get your solutions. So you would have a 50-50 solution, which is half hydrogen peroxide and half saline water. You would have a container of just saline water, and then you would have a container of just hydrogen peroxide to clean the inner cannula. You would also have some 4x4 gauze, a split 4x4 gauze to change the dressing that sits underneath the site. You would have Q-tips, your brush to clean the inner cannula. You want to get a syringe to inflate or deflate the cuff if needed, and then you would also want to bring an extra obturator just in case there wasn't one hanging inside the patient's room, which they should. And this will just help guide the trach back in case it popped out or anything. You also want to get your stethoscope and your pulse ox. So then you can go ahead and go into the patient's room. You would want to wash your hands with 3 ml of hand sanitizer, put some gloves on, and go ahead and introduce yourself. Hi, my name is Cedeno. I'm a student from the respiratory department. Can I get your first and last name and your date of birth? And then you would also want to verify with the patient's wristband to make sure that it's the same. So when you go in the patient's room, you want to explain the procedure to the patient and any family members that are in the room. So I'm going to go ahead and clean around your trach site, and I'm going to be cleaning your inner cannula, which could cause you to cough. So then before you start the procedure, you just want to go ahead and assess the patient. You want to go ahead and listen to lung sounds, and you can put a pulse ox onto the patient's finger. So I'm just going to go ahead and listen to your lungs. Okay. And if you heard any crackles, that could be an indication that the patient needs to be suctioned. So then you would also want to check your ambu bag in the patient's room, and you would want to make sure that there's a mask just in case the trach got occluded. Then you would just want to hold the stoma site and then bag via face mask. So you'd also want to check to make sure that the ambu bag is working correctly. So the first thing you would want to check if the duct bill is open and closed. Then you can occlude the valve and make sure that the pressure stays. Then you can also squeeze the bag, occlude, and make sure that it refills back up. So then you can go ahead and start your procedure. You would want to pre-oxygenate the patient because you are taking out their inner cannula. So then you would go ahead and tell them that you're going to take them off their oxygen source. Then you would go ahead and discard the old dressing, change out your gloves. You would also ask the patient if it's okay if they put a towel or a pad on top of them, just so their gown doesn't get soiled either. Then you would go ahead and put your gauze in the 50-50 solution, which is your hydrogen peroxide and your saline water. And you would put some in your saline water as well as your Q-tips. So then you would go ahead and start with your Q-tips, the ones that are in the 50-50, the hydrogen peroxide and the saline water. You would go ahead and tell the patient that you are going to be touching the phalange just so you can get close to the stoma site. And you would start at the middle of the stoma site and then roll towards the outward. And then get a new Q-tip. The same solution, go ahead and go on the other side. And then you go towards the outside. And then the same thing, the top. Go from the middle, roll outwards, and then same thing with the other side, the top, and roll outwards. Then you would go ahead and get your sterile water Q-tips and do the same thing. Start from the middle, roll out, grab a new Q-tip, same thing, bottom, middle, roll out, get a new Q-tip, then top, middle, roll out, get a new Q-tip, same thing other side, middle, roll out. And then you would go ahead and do the same thing but with your gauze, so you're 50-50. You would go ahead and get under and then roll out, and you can also fold the gauze so you're not getting a new one. And same thing, middle, roll out. And if you can see that the phalange is visibly soiled, you can also wipe that down as well. Keep it clean, and then top, middle, roll out, fold, and middle, roll out. Then you would do the same thing with the sterile water gauze. Middle, roll out, fold, middle, roll out. And also check if the patient's neck has any redness or if they have any granulomas. Top side, middle, roll out, fold, and middle, roll out. And if the patient has any prescribed antibiotic or antifungal cream, you can also put that as well. And then now you can go ahead and clean the inner cannula. Just let the patient know again that if when you take it out, it could cause them to cough. So you go ahead and let them know when you're taking it out. And then you would put it in your hydrogen peroxide solution. You want to go ahead and scrub the outside, make sure you're scrubbing the inside, and then you would rinse off with sterile water because you are putting it back into the patient. So then you would go ahead and let them know, okay, I'm going to go ahead and put your inner cannula back in. You would want to make sure you hear the click. If you don't hear, you just want to verify it by just giving it a little tug to make sure that it is securely in. So then after that, you would go ahead and put a new dressing underneath it. So you can also do this with another Q-tip, which will help you guide underneath. Make sure that the cuff is outside so it's not getting tangled. Go ahead and dispose of this. Always make sure that your patient is doing okay and they're stable. So after that, you can go ahead and post-oxygenate if needed, and then you would go ahead and check for minimal occlusion or minimal leakage with the cuff. And how you would do that is you would take your syringe. So for minimal occlusion, you would go ahead and start with the cuff deflated, and you will hear the leak. And then you grab your stethoscope, put it against the trach site, and then you go ahead and re-inflate the cuff until you no longer hear the leak. So that's your minimal occlusion. For the minimal leakage, you'd start with the cuff inflated, and then you would go ahead and draw back until you hear a slight leak. Another way you can check the cuff pressures with a manometer, you go ahead and just insert it, and you would make sure that it's within the green triangle or within 20 to 30. Okay. And then afterwards, if the patient was on a pass-through valve, you can go ahead and place that on too. And with this, you want to go ahead and deflate the cuff first. And before that, you would want to suction orally with the Yonkire, suction orally, and then you would go ahead and deflate the cuff. And then you would place the passing mirror valve on. Another way that the patient could speak would be if they have a fenestrator tube. So if the patient wasn't on the passing mirror valve, you can go ahead and put them back onto whatever oxygen source that they are on. And then before you leave, you also want to change the trach tie. So with this, you would go ahead and slip this in. And let the patient know that you're going gently. And let the patient know that you will be pretty close to their face. And then with switching the ties, you also want to make sure that you're never letting the phalange go. So then you would go ahead and hold it, take off the old soil, and go ahead and place this on. Take this off. And then you would also want to make sure that it's secure by placing 2 fingers underneath and seeing if it's snug. So after that, then you can go ahead and put the patient back onto their oxygen source. And you would want to go ahead and reassess the patient. So you would place the pulse ox, listen to their lungs again. Alright, so the patient's good. Make sure the patient is stable. Ask them if they need anything. Then if you believe that their artificial airway is dislodged or it's not going in all the way, you can also ask the physician if you can order a chest x-ray just to ensure that it is in the proper placement. So then you can go ahead and leave the patient's room, dispose of your gloves, dispose of all your equipment, wash your hands, and then you would go ahead and chart any significant findings.